example of what to do if you recognize that you've become frustrated. And I know that not a one of you ever get like this on Fort North. Just imagine it's Thursday. Yesterday. Okay. So what do? You could
ask for help. See if someone else could maybe help you do something.
Okay. Just
stop for a few minutes. Doesn't need to be long, just a few minutes. Take a deep breath. Maybe get off the floor for just a minute and then go back, and you're not as bad.
Well, I like the program. I think that as busy as nurses are, as difficult as our jobs are, that it has given me a new opinion of especially the issue of complacency, because I am more complacent, or I think I'm more complacent than I thought I was, and this has just given me a different outlook. It has given me, you work so much with sharps that I've gotten a little complacent, I think, and especially given chemo, you can't be complacent. So it's helped me in that area, keeping my eyes on the task, the mind on the task, and doing the best I can.
And I think it's been a good program for the nurses on Fort North. It's making me more aware. Days I'm on charge and the phones are ringing and the stacks of charts are mounting and I have physicians talking to me 2 and 3 times. It's made me more aware to slow down, and my frustration has gotten less. I feel I do better because I have taken this class, because I do slow down. I feel my errors are less.
some days it's really busy up here. We have like 4 sets of residents, a bunch of doctors, and I'm answering phones, entering orders, and answering all the call lights, calling the nurses, and the phones are ringing. And it's very difficult to keep your mind on what you're doing. I just finished the SafeStart program, and it's made me more aware of what I'm doing each day. I've slowed down and thought about what I'm doing, and my mind's on the task that I'm trying to do. And I take breaks when I feel frustrated, and it has really helped me a whole lot.
I was an instructor for the SafeStart program, and it's been really well accepted up here. People have been real cooperative to come in on their days off to go to do all 5 of the weeks of the program. It's been had a real positive impact on the unit. People talk more about being, when they're frustrated or tired, reminding each other of, while you're frustrated, slow down, or being more aware of our line of fire when we're walking around, turning around in the unit. I've heard people say, "Don't get in my line of fire."
I think it's a good choice for the hospital to be involved in. We're affiliated with Marshall University, the medical center here, and so there's a constant influx of new residents, attendings, new physicians, new orders, people learning, and we have to watch our orders very, very closely. This reminds us that they're also learning as their students, and so we have to help them. So we have to be more keenly aware. SafeStart has reminded us that preventative is much better than trying to fix something after it's broken.
I was excited with this product and wanted to be a pilot site because this product was designed specifically to address the behaviors of our caretakers. And I felt that it was one of the first products that I've seen that directed its attention to that specific topic. I think the fact that it was so brilliantly simple was probably the biggest thing for me. You know, when I started listening to it, I thought, oh, this is simple and it's going to lose our caretakers' interest. But by the end of the day, I was already practicing the principles. If we got the right amount of spin and the right amount of repetitiveness where the caretakers wouldn't have to study, they don't have to memorize, they don't have to work on getting the material down, they just need to focus their new skills and practice those, there's a good chance that it could be successful.
I think that these were ideas that I knew about and kind of sensed were things that might bring my attention away from the task and cause me to not practice as safely as I might otherwise. But then just seeing them all articulated and put down in a very logical process that I could repeat to myself really, I think, has helped me to be able to be more effective in my job and hopefully communicate that to others so that we can keep our safety and our quality high for our patient care. The rushing, the fatigue, and the frustration happen many, many times throughout the day. Healthcare is not an easy profession to be in. We are constantly being inundated with new information, making changes, trying to still practice at a high level. And so those three things happen almost constantly. And then being aware that by having all of those things in place increases the likelihood that I may not be able to perform as safely as I would like to really helps me recognize that and then put some changes in place so that it doesn't happen.
You want patients to have a nice stay at your hospital. You want them to have a safe stay. And in order to facilitate that, I think the points brought up in this class really helped reiterate that. The interaction between the employees who were actually taking the course, I think that the stories and the examples that we're giving really, brought home, the ideas and the things that need to be, stated in SafeStart.
I think it's everything that we knew and what we've thought about in the past, but I think it's given me a heightened awareness. It's almost like I have a super conscious now that's telling me stop, think what you're doing before you react.
In the beginning, it seemed as though some staff were saying, oh, this is just really basic, common things, and they're things that I already know. But once they completed the entire program and actually talked about it on the unit, I've heard staff say, that, wow, I really did think about that. I really did think about how I was driving home. I really did think about stopping at that stop sign. I mean, there are simple things, but they were easily applied to their work environment also. I certainly find the workbooks very helpful and beneficial to me to bring that information to my staff. So I'm really glad that the way it's laid out, it's very easy for me to make sure that I drive home the very important points that are easy for them to pick up on.
The instructor guides are well written. There's a lot of icons that prompt you, and there's not a whole lot for you to do on your own. It's all presented there for you. The most important part, or the one that was most influential, I think, that I picked up on the audience, I think they like the demonstrations. I think they like the interaction. I think they like to respond. They like to tell you their experiences.
If we all are aware of what's going on and we can, pull on each other and say, I see that this is happening, I think we can do this another way. I think we could all work together, and that's what we want to do, is work as a team and improve our unit and improve patient satisfaction.
There's a lot of demands on nursing, which leads to a lot of frustration and different problems. This, by focusing on a simple plan that makes you aware of what you're doing, that may contribute to the frustration, how you can control it, I find very beneficial. It focuses on those things that can help us decrease the incidence of errors. And in that way, it's a very important program.
I'm more aware of my surroundings. I'm more aware of what's going on around me, as well as not only myself, but with the employees that I'm working with. And I do try to point out, different situations, different examples, so that we can make it a safer place to work.
I get these little triggers, and I've seen since I've started the program about I can feel the frustration building in me. No, wait a minute. Now what can we do to make this just flow a little smoother? And if I don't know the answer, sometimes I bounce it off and another employee and say, what do you see? You see something we can do to make it better? and it really does work.
I was driving down the road and I wasn't paying attention. I was thinking of something else, and I started to get off on an expressway exit that I should not have been getting off on. And I started thinking, am I not on task? And I need to get myself back into the present and start to really experience what's going on in the present.
I find myself doing that when I'm driving and the cell phone rings and the child is talking to me, and I am forcing myself to just not answer that cell phone because it's just not safe. How many times as working people who also have family lives and a lot of things coming at you at once, when you leave your work environment, we can try to keep ourselves a little more safe in that way. Personally, I think I can probably handle the rushing and or the fatigue. The sneaky one for me is the complacency, because of course that would be the most insidious. You don't realize that you're being complacent until something happens and you think, well, I really didn't check all the things that I was supposed to check. But just being aware that more than one thing happening to me at once makes it more likely that I'm not going to be able to do the things that I would like, the way that I would like to do them. We are in risk management and in healthcare in general moving toward a non-punitive environment, which is something that we really want. To be able to deal with issues as they occur, we need to know that they're occurring. And people need to be comfortable in a non-punitive environment to bring those things forward. And so by being able to recognize that and say, you know, I can't do the perfect job all of the time that I would like to do, but I didn't come to work today intending to make a mistake either. Being able to recognize those 4 states that lead to those 4 critical errors is going to make it a lot less likely that those critical errors may happen.
I was doing some work on one of my floors. I was picking up some extra time, and I was with the meds, and I was like rushing, trying to get my meds because I started a little bit later than everybody else, and I realized what I was doing, so I made myself slow down and make sure I checked everything, so I didn't make an error.
In a setting where you had enough support and there were a lot of caretakers that had had the training, they could use each other to practice those skills and to really get good at what they were doing.
As a leader, we consistently drive home to employees policies, procedures, and process. And if you can relate something that's just personal and that's automatic all the time, like getting up, taking a shower every day, it's very easily applied and you can follow through with that.
What I've most gotten out of the program are those little triggers that tell you you're rushing. Now you really have to pay attention to what you're doing. You have to check that label 3 times. You have to check the patient's name band, because that one little split second that you do that will save you a lot of time in the end.
Patient safety is a relatively, not a new focus for healthcare, but it's something that has been brought in the forefront because of Joint Commission. And we are all looking forward to being able to validate our safe processes. And I think this is something that we will be able to take forward to the Joint Commission, to anyone that might be looking at us and say, look, this is what we do to help keep our patients safe, to help keep our employees safe.
Just that camaraderie of them sharing it amongst themselves and holding each other accountable is going to enhance our team, and I think that's going to be the biggest benefit for them. SafeStart is different from other safety initiatives in that it gets right down to what's important to people. SafeStart basically gets down to basic things that are easy applications that they can apply to themselves in their personal life, at home, and therefore carrying through it at work. And it's something that can be applied over time that they can never forget, really. Something very simple.
In today's age, there are so many demands on the caretaker that if you sit down with a product and you say, guess what, tonight you're going to go home and you're going to study 2 pages and we're going to have it memorized for a test tomorrow, you're not going to get eager participation, nor are you going to get buy-in. This product doesn't, the teaching program with this doesn't demand that. What it is it's set up in a repetitive manner so that the same acronyms are used in the same way all the time. And you start hearing it over and over and over, and pretty soon you're able to spit them out in order so that you know them, even without practicing it. And it's very easy, and that was one of the things that really I think I found most beneficial, because I could not possibly see myself overloading the clinical staff anymore. I can tell you from a social perspective, another side of this product that I appreciate, and that is that the frontline caretakers, whether they're nurses or nurses' aides or work clerks or whatever, feel that by giving them this training and education that we're hearing them, and that patient safety is important to us, and that the frontline staff are the ones that really make the difference. And that's a benefit that I didn't expect.